Hi, I'm Kasthuri Rengan, and this is my colleague Sneha Kumaraguru. We both are music therapists from Chennai School of Music Therapy, where we did our 1 year diploma course. In Chennai School of Music Therapy, we have 1 year of diploma training course, and there's also 6 month certification course. The difference between the courses are that in the 1 year course, they have an on site internship training where they are given scope to work in the field with various populations and gain experiences in music therapy.
We are trained to work with children with different kinds of disabilities. And not just that, we also receive training to work in different other setups like, working with cancer patients or working with pregnant women, working with the geriatric population, or in different clinical setups like neurological rehabilitation, pain management, and different, clinical setups like that. So I have been working primarily with children with special needs, like children who have ASD or ADHD, or children with global developmental delay or cerebral palsy. So I've been working with them for the past 1.5 years or so. Music can work wonders for children who have ASD or ADHD because they'll have an internal innate ability to have a musical liking, and their musical abilities are good, right? So they tend to easily bind to that, and their responses will also be good according to that. So through all these things, through music therapy, we are just going to focus on the non-musical goals, like whether it's going to be development of their gross motor or fine motor skills, or to improve their attention span, to improve their behavioral issues. So in all these things, music is going to be used as the main motivation through which we are going to make the children achieve the non-musical goals that we have set.
Is music therapy effective?
When we talk about whether it is working or not, yes, we cannot tell that it works universally in the same way for all the children. So it's different for each and every child. There is no one particular mode that we use. We use different modalities like, singing, playing instruments, using musical puppetry, musical storytelling. All these different kinds of things are used. And also the technique or the method that the therapist has chosen for the particular session depends on the child's musical preferences, what the child is liking, or on that particular day what the mood of the child is. According to that, the therapy sessions would be designed, and it will be changing. There is no one particular mode that we will be using. We feel that weekly 2 to 3 sessions are required. A minimum of 2 sessions would be required. 3 sessions per week would be ideal. Yeah, because if we don't have that regularity, then it will be very difficult for the children.
I would say, in my opinion, that working with children is really, it's really gifting. It's really, there's a lot of reward feel that you get while working with children. But I mostly have worked with adults, and I see that the responses to the music therapy is, there is a lot of stigma. Yes, there is a lot of issues that is present around music therapy, wherein people do think and assume that why do I need music, or why do I need music therapy, wherein I can just put on the headphones and listen to any music I want. But we use more music notes and music notations on a very purposeful and a very objective oriented note. And I wouldn't want to compare between how it works for adults and children, but it has equal benefits for everyone. And anyone looking out for wellness, anyone looking out for using music to achieve certain wellness goals, music will definitely help them. Music has a very strong impact. When it comes to working with adults, I think the number of sessions that we assess and we derive at depends on the objectives that we need to work. And if it is a very intense or a very severe objective or an issue that we need to work on, which requires more emergency basis, then we'll have sessions on a daily basis for them, which has a more strong impact. And if the objective is more relaxed, that they can work on their own, where we give them the space to work on their own in their home. So it's more of where they come for a session, they get equipped with certain skills and certain ways in which they can handle music for themselves. They practice it in their home, they use it for relaxation, they use it for sleep. And that again depends on how effectively they are doing it in their home. So it can vary somewhere between having sessions even on a daily note and also weekly once, or 2 weeks once. When I was working in the cancer department, when I was working for patients who are undergoing chemotherapy treatment, I've had experience with clients who have had changes in their objective parameters, which includes their BP, which which includes their blood pressure, which includes their heart rate. So all these have had significant impact, and through the use of music, through the set methods and techniques that we use, which is more targeted and which is more client oriented and client centered, the music therapy techniques has contributed in helping them achieve that objective. I've had experiences where I was working with a client who felt so comfortable, who felt so relaxed, who felt so calm in a hospital environment, which obviously is very stressed and very noisy, very loud. And he felt really comfortable, and he used to ask the nurses for he used to ask the nurses for the music therapist to walk in, and he would always prefer for the music therapist to have a talk, because the chemotherapy procedure takes like 2 to 3 hours, and once the initial formalities are done, the nurses walk away, and there's nothing much for them to do. And that's when we go in, and that's when we keep them engaged for a certain period of time, and we talk with them, we give them the space to emote, express themselves, because cancer is definitely not a very simple disease, and there's a lot of complication that comes. They undergo a lot of pain, they undergo a lot of stress in their families, the families goes through a lot of stress, and it's equally important for us to handle the patient, also handle the caretaker in helping them be well and achieve that wellness. So yeah, it's been really good working for patients.
What are some common misconceptions about music therapy?
In our country, there is a very prevalent confusion between music therapy and music education. So we have to understand that music therapy is different from music education. In music education, it is more of working on their musical abilities. They focus on improving their musical skills, and the goals are only going to be musical. Whereas in music therapy, we are not going to focus on any musical goals. It is achieving the non-musical goals through the use of music. Different kinds of musical modalities through which we attain either improving their attention span, or improving their ability to improving their fine motor skills, or improving their sitting span, improving their memory functions, reducing their pain perception, or improving their breathing rate, reducing their regulating their blood pressure. So all these things are non-musical goals, which will be attained by the use of any musical experience. So that is one of the main misconception that is related to it.
Also, there is a very strong belief that if I take music therapy, will it cure my disease? Will I get cured of the disease that I'm going through? Or will I get cured of the issue that I'm going through? Will I be cured completely of stress? And we do not claim at any point of time that music therapy can cure in anything. So music therapy, what we call in music therapy is, it's a complementary medicine. It's a complementary way of, helping people go through their issues, helping the people come up and cope up with the issues that they're going through, in accordance or in complementary to the main treatment that they'll be taking in. If, for example, if a client is undertaking in a hospital a major treatment or a major issue that the client is going through, they'll be getting the main treatment, they'll be getting the main medical treatment from the hospital. They'll also be getting other treatments, like going through the diet plans and all the physiotherapy modalities and everything. Likewise, music therapy is also a complementary way in helping them ease through the process and cope up with the daily stresses that they're going through. So that is one very major misconception that people think can get cured of.
And one more thing is that when we say music therapy, it is not just listening to some music, some pre-recorded music over headphones. So as we discussed before, we use different methods, like we engage the clients in listening to the music that the therapist sing, or we engage them in participative singing or playing of musical instruments. So there are different modalities that will be used, and it's not just listening to some pre-recorded music. And also, when we say music therapy, it is a holistic approach. So it's not just going to focus on your biological health. We also look at the psychological and social health as well. So all these different facets are looked upon, and they are given focus on when we work with the clients. Some people, they might have another misconception that if they want to receive music therapy, they should be musically trained. That is definitely not there. The clients need not be musically trained to receive music therapy. So one more thing is that for becoming a music therapist, you should have formal training in music, but you don't require any musical degree as a compulsory requirement. So, for example, I did my MSc Biotechnology, and then, but I've been trained in Carnatic music from my childhood, and because of the passion that I had towards the field, I took up the course, and now I'm working as a music therapist.
I've been training in music since I was the age of 5, 6, and I have been having a very crazy passion towards music. I trained in I had my degrees in BCom, and I found that not to be my cup of tea, and I went into Masters of Social Work, where I was working for patients undergoing major psychiatric illnesses. So I specialize in medical and psychiatric social work, and that's where I found using music for patients in a therapeutic form has a very strong context. That's where I wanted to have a proper training to learn and understand the scientific nuances of working for people in terms of using music in a therapeutic context. That landed me in music therapy, and I'm glad that I took this opportunity to work for children, to work for adults.
How has music influenced you as a therapist?
If I have to talk about my personal experience or development, yes, it has made, I am a patient person, but it has made me even more patient. And I've started believing in, the small things in life. Like there are a lot of difficulties that people go through, and it has made me a more resilient person, I would say. And yeah, the passion has become more. I had the passion, and that's why I got into this field. But working and practicing music therapy has, added more fuel to that passion.
To me, I think it's very more intricate to talk about how I grew with music, and when I take music to people, and when I tell people that I'm a music therapist, I've been working in so and so. Often the question that I get often asked is, what does music therapy? What does music therapy do? How does it work? It's a very unique field, and kudos to you for taking such a new field. And it has been helping me in terms of how I can use music for myself in my daily life to improve my well-being, to use it as a meditation practice. Now I can implement it in the people around me, for the people around me, and it has been really contributing largely. And of course, the passion towards music therapy is something that keeps on going for a very long time.